Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the future of fascial healthcare, the benefits and the challenges. You can imagine a world where a doctor's visit is just a click away, and it is happening in the banking sector. You can access your money at the comfort of your home. You can transact whatever business that you want. And we are looking forward to a situation where healthcare is going to reach to that level. So the global telemedicine market is projected to reach between 559 billion shillings by 2027. The objective of this video is to discuss these game-changing benefits and the obstacles we must overcome in a fascial healthcare. So the rise of fascial healthcare. Over 60% of the healthcare institutions now are offering telemedicine services. This especially has grown exponentially after the COVID-19 pandemic. People realize that actually you can offer healthcare at the comfort of your home, and the patients can be accessed from the comfort of their homes. So this increased adoption has made it very convenient, and it has also made fascial healthcare a necessity. So telemedicine is not the medicine of the future. It is the medicine of now, as we have seen it. So what are the key benefits of fascial healthcare? One, there is the issues of accessibility and convenience. So doctors can be accessed anytime and anywhere. And this makes it even easier to access specialists and subspecialists who are not easily accessible, especially in the rural people who have difficult accessing healthcare. And in times of emergencies, if patients have critical issues, they have difficulties making decisions, then fascial access has made it possible. Then there's the issue of travel time and the wait times at the doctor's office. This can be reduced significantly with the fascial healthcare. Then the issue of cost, there is the lower cost because you have cut the cost of traveling, you have cut the cost that you are going to spend at the doctor's office, and also the payers of the healthcare, the expenses have been reduced. Then there is the issue of reduced admissions and readmissions because patients can consult before issues get out of control, and they can be helped at the convenience of their homes. Then there is better management of the chronic diseases like diabetes, hypertension, conditions like asthma, because there is remote monitoring of the condition, and this helps the patients to monitor how their progress is. They can send the information to their doctor, then their doctor is able to make adjustments so that the conditions do not escalate, and this helps to manage the condition. Then there is the AI powered reminders for medication adherence. So we have the wearables, and I've talked about this in one of the previous videos, whereby patients can be able to progressively monitor their blood pressure, monitor their sugar, monitor how their oxygen saturation is, and send this information to their doctor. And the doctor can be able to make adjustments where necessary. Then you can have confidential therapy sessions via video calls. Some of the mental health problems can be easily treated via fascial access. And also there is the issue of 24/7 access, especially in times of crisis when patients don't know what to do. They can easily access their doctor through the fascial method. I know of some patients whom we have been able to manage virtually. They just give me a call, they give me the symptoms, especially patients whom you have been able to, you have seen before. You know, there is their conditions. You can be able, I have seen patients with allergies. We have been able to manage them online and discuss the conditions how they have been progressing. I've managed some of my patients with diabetes through fascial connections, and this has helped very much because the patients do not have to come to my office, they do not have to travel, because some of them have issues of travel, busy schedules, and even some of the other, like the children we were managing with allergic condition virtually. The access to my facility, sometimes accessibility, transport issues, the issues of jams, then it becomes difficult to come to the hospital. And giving advice and knowing the patient condition virtually has helped for these patients to be better managed. So what are the challenges and the barriers that we expect to face with the digital and the virtual healthcare provision? One, there is the digital divide and the accessibility. We know that in the middle and low income communities, there is a lack of access to stable internet, and this makes it difficult for you to be able to reach patients as well as possible. Then some of the patients do not have smartphone access, and so this they can only be able either to call, but you cannot be able to see them virtually. Then elderly patients may struggle with the technology. They are not so well versed with this new technology, so this creates a barrier to be able to help them. But if those who have access, then they have next of kin whom you can be able to access, it is easier to access them. Then the issue of security and the privacy concerns, the risk of data breaches and compliance issues, they are still an issue in our setup, which we need possibly to work on. Then the issues of patient confidentiality and the uh, trust in the virtual platforms. Patients are worried, and there is concern about who is able to access this information and how can they use it for detrimental. Then there is limited hands-on examination. Some conditions require in-person diagnosis and treatment. For patients whom we have not been able to see before, especially for new visits and new concerns, it could be difficult to be able to access the patients and do a physical exam, and this can hinder some of the condition being diagnosed appropriately. Then we rely so much on the patient self-reporting, and this can lead to misdiagnosis. So these are some of the challenges that we expect. Then regulatory and insurance fund issues, inconsistent laws regarding telehealth across the regions, and then there is also the insurance coverage limitation for virtual consultation. The insurance companies have not really embraced virtual consultations as a way of accessing healthcare, so reimbursement has not been provided. So how can we overcome some of these challenges so that we make virtual healthcare a reality and make it more accessible to many people? One is trying to bridge the digital divide by expanding the internet access and the technology training program, so that most of the people are digital and the internet literate, and this will help them to access the virtual health. Then strengthening data security, where there is use of encrypted platform and strict compliance to this, so that information cannot be accessed by people who are not meant to get it. Then the hybrid care models, whereby you can combine virtual checkups with the necessary in-person visits. Especially what I see in my situation is whereby for patients whom we have seen for the first time, you have done the tests that are necessary, and you know what is the condition of the patients, then it is easier to follow up on a virtual basis. One of the things that we do is doing patients follow up with telephone calls. There they can tell you they got the drugs, have they gotten any side effects from the drugs, are they having any challenges, is the condition improving, is it worsening, and this helps you to be in touch with the patients, and they get some of the concerns that they may have. Sometimes it could be just be small issues like what time do I need to take my drug? I've measured my blood pressure today. I've realized is elevated. Do I need to take emergency drugs or need to be consistent with my program? The patients sometimes they may start an exercise program, get some difficulties, and they want reassurance that all is well. Then policy advocacy, so that we push for telehealth friendly insurance and legal reforms so that this becomes a reality.